Okay. Hi, everybody. Good afternoon. Hopefully you had a good weekend, a good Easter, everybody who celebrates. So, mind everybody, on weekends, we don't give out hospital or death data. We save that for Mondays now so we get accurate data. Unfortunately, we lost a male in his 50s, 54 years of age over the weekend. Certainly want to remember him and his family. We've lost 693 of our residents to COVID-19 in the pandemic. Positive rate, 1.2%, since we've seen an uptick in we'll say 18 to 30-year-old cases. It's impacted the positive rate by about 0.4%. So not abnormal. With what other communities have seen at this point with vaccinations, but also it makes sense if you think about springtime. These are more social demographics. It's been a year. We've had some community activities that certainly people we know are gathering for. So overall, it looks like we're going to have I'd say a 7 to 10 day period of time where our cases will be elevated from where they were, but hopefully we won't be seeing them go much more above that. Speaking of cases, 582 active cases. From my weekend updates that I gave, let's see here, 17 of those cases were actually transferred out this morning to other counties. So it was actually 17 less over the weekend from the 2 days we reported on. Today we're reporting 100 new cases. So Saturday we had actual numbers. Saturday we actually had 82. I think I said we had 83. Yesterday we reported 94 as an actual. Or today we're reporting 94 for Sunday as an actual. I think I said we had 109, and then today we had 100. So that's where the cases are. Overall, same trend. 73% of the cases are under 40. If you add that 40 to 49-year-old demographic, that number goes well into the high 80s. So the good news related to cases is the demographics that have been vaccinated for an extended period of time now, we are just seeing very little COVID activity, which is really promising. Obviously, with vaccinations this week, we really open up our ability to vaccinate different demographics. So hopefully 3-4 weeks from now, we'll see these numbers really start to go very low. Hospitals, 34 individuals in the hospital. We have 4 in the ICU. I think that's the lowest we've been in a little bit. So that's good. Let's keep these 4 people in our thoughts and prayers, get them home. Related to the vaccine, so tomorrow, technically, anyone 16 and above can get a shot. So a reminder, if you're 16 or 17 years of age, you need the Pfizer vaccine to get your shot. Moderna is 18, Johnson & Johnson is 18. For us, tomorrow and Thursday, we will have Pfizer clinics, so for first shots. So certainly, I think there is some appointments available tomorrow and Thursday. So that is, please take advantage of that. We are getting Syracuse University 1,500 doses for a clinic that they'll be working on this week. We may do something else with them later this week. We're also in touch with OCC and ESF in Lemoyne and have been on working to get their students who haven't been vaccinated yet vaccinated. In addition to that, we will and are talking with high schools about getting essentially 16 and 17-year-olds, and if they have 18-year-olds vaccinated as well. Obviously, guardians will have to grant permission for those underage, but we're going to have that conversation and figure out ways to get that done too. Essentially, those if you flow from your juniors and seniors in high school through, let's say, late 20s, early 30s, that's where the virus is in the community, so we're going to go attack it. We'll do a pop-up clinic on Wednesday for the 13204 zip code at the Hamilton Street Boys and Girls Club. As we move forward, I think in at least 2 weeks, but really probably maybe even sooner, what you'll see is the mass vaccination sites will not be as busy. And so at that point, we'll need to re-strategize and come up with more of our mobile testing teams. The model we use for mobile testing will have to become mobile vaccination teams. So we'll go into communities specifically that are lagging with the zip codes and try to get there to get these numbers where we need them to be. Overall, again, we'll go through a couple more points here on the vaccine. We'll have a vaccine registration phone bank for our blind and visually impaired community. Tomorrow, April 6th, we're hosting the phone bank. It will be between 12 and 4. Please call 315-679-4099. Our workers will assist these residents on getting appointments and provide the times to the callers. Today, we'll go over 180,000 first shots for adults. It's about 50% of the adult population, so that's significant. I think, obviously, depending on the epidemiologist you speak to, people believe the herd immunity needs to be between 70 and 80%. I think in Israel right now they're seeing more success lower than 70, but certainly our goal will be to get to that 70 to 80% number. But that's why I think our vaccination strategy is going to have to shift as more and more appointments at the mass vaccination sites remain unfilled. Going to these communities will probably become a priority as we start to see more appointments go unused. Looking at testing, please, if you're on spring break and you're just getting back home, please consider getting a test, especially if you haven't been vaccinated. The reality is we probably will have an uptick in travel cases over the next week, whether that's 3 or 4 a day or 10 or 15 a day. And then what happens after depends on if people want to get tested and need to get tested. So Cayuga Medical, our partner at the fshed ongov.net/Cayuga Medical, Monday through Friday, 9 to 1 for symptomatic testing. And then we have our asymptomatic program with community sites throughout the community. Certainly we have it here at the On Center, I think 4 days a week, but also East Syracuse Village Hall today, tomorrow, the Northeast Community Center and the Lafayette Community Center. Wednesday in Skaneateles at the school district offices. Thursday, Onondaga Town Hall and Shove Park. Friday, the Town of Clay Senior Center and the Fayetteville Village Hall. So that's kind of a COVID update. A couple things related to the budget that I've gotten questions on from the media, so I might as well talk about it. 2 things really we're following right now. Certainly widely reported that the state legislature and the governor have agreed on raising a lot of taxes, a lot of new revenue. Certainly, if you're going to raise new revenue, local governments shouldn't receive any cuts, period. We're the ones on the front lines in the pandemic. To give you an idea, the state funds, the state doesn't really fund our parks. They don't really fund our sheriffs. They fund our health department. They fund our children and family services department. They fund our human service departments. So any cuts to us go to those areas. So certainly areas impacted by the pandemic. We've been talking to our delegation. I know our delegation is working hard to make sure that we don't receive any cuts. There's no excuses if you're raising new revenue on top of getting $12.5 billion to cut local governments. No excuses. Second item, which impacts us, which we're very concerned about, is the mobile sports betting. Right now, some of the proposals have the non-tribal casinos basically helping to administer this. We are part of the Oneida Nation group, 10 Central New York counties. To give people perspective, when this law came into consideration and we decided to join the Oneida Nation, if we didn't join, we would have had the opportunity to get our own casino. But we deemed it was in our interest to work with the Oneida Nation, and that's been a very good partnership. We receive close to $4 million a year because of that. The Oneida Nation, and we tend to agree with them, view that if they are excluded from this gaming, that breaches the contract that the state of New York and local governments came to with the Oneida Nation. This is very bad. So certainly we support mobile sports betting, but the Oneida Nation and Central New York communities need to be recognized in this. So those are two key items with the New York State budget that we are following, and hopefully we'll get good results on both of those. Saying that, happy to take questions.
Would you give a little more context on the sports betting and for the person at home listening, how the current plan without the Indian casinos being part of it hurts people in Oneida Nation 10-county territory?
Well, it hurts us badly because we share in that revenue. So basically what the United Nations is saying is if you breach the agreement, we're going to stop making the payments. So that means the state of New York will get less. Does that hurt the local taxpayer if the state of New York gets less? Not really. It's a huge budget, right? $200 billion budget. But $4 million to us is a lot of money. I think Oneida County gets, close to $17 million. That's a huge amount of money for that government. Madison County, a lot of money. Every county in Central New York gets a piece of the action there. So if there's a dispute between the Oneida Nation and the state, and we get cut out of that, that means we don't get that funding until the dispute is settled, let alone the Oneida Nation has been a great community partner and they're a great employer. So this is just, there's no reason for this to even be really a food fight. We understand that the other 4 non-tribal casinos haven't done as well. That's not our fault. We decided to go this way. Central New York shouldn't be penalized because the other 4 privately run casinos aren't doing as well. One has nothing to do with the other.
Do you think we'll see a spike in cases from Easter, or do you think vaccine will help us back and stay down?
Yeah, I think there's a couple factors that could lead to more cases. Certainly, the reality that younger people are, fatigue isn't even the right word, right? Certainly spring break, travel, we'll see more travel cases. We always do. Gatherings for Easter, maybe, right? I think overall it was a nice day. We've had, we had 176,000 adults vaccinated going into Easter, so I'm not sure if that will drive spikes, but will any gathering lead to cases if somebody's got COVID there? Yes, it will. So I think overall, we haven't seen the spikes other communities have seen in Western New York and even the Finger Lakes. Overall, I think we're doing the best out of any large county in the state right now with our positive rate and with caseloads. Certainly, they've gone to kind of a different range. We think that will be a short period of time in this range, not an extended period of time.
And when eligibility opens tomorrow for vaccine, do you think people will be fighting for appointments again, or do you think we have plenty?
Yeah, there's a lot of supply, so I don't think so. I think part of the challenge is going to be more in 2 weeks. We can't fill. We're supposed to fill 1,200, 1,300 a day here, if not more, and we're filling 400, 500. I think that's going to be more the concern in 2 to 3 weeks. That's when we'll have to really start our micro-targeting and figuring out where the holes are in the participation and how much of that is just the distribution channel. If you change the channel, you'll get participation, and then how much of that is hesitancy and what can you do to cure the hesitancy, if anything.
How much do you suspect Syracuse University cases are to blame for that age group going up in cases?
Yeah, until the last, I'd say one part of the last week, their positive rate trended lower than the communities, and then all of a sudden there was a couple days that it went higher for the first time. Even when they were having 20 or 30 cases, they were producing a lot of tests. So I think there was that kind of flipped at some point last week. I haven't seen the latest data, but I don't think they had a lot of cases out of their latest batch. So maybe you're seeing it. And remember, some of these new cases are kids in quarantine who then test positive. So you're already in a quarantine. It's like you're a household contact. So the risk to the rest of the population goes way down. But certainly look at congregate settings are a problem. I was asking to vaccinate these congregate settings a month ago. That probably could have changed some of these outcomes.
Do you have a sense yet of what the interest is in college kids in getting vaccinated?
Hopefully, it's a very large one. If you want to think about your on-campus activities that you normally have, your on-campus activities won't change in a great deal until you have large vaccination rates on those campuses, right? Where the campus is sponsoring these events and this event and that event. Sure, can they go to off-campus things and still socialize? Yes. But the full college experience does not come back if these kids don't vaccinate, just like in the same percentages that everybody else needs to in the community. So I think they have an even larger incentive, quite frankly, if they want to get that college experience, which normally you only get at this point in your life.
Can you speak to developments on a vaccination partnership front? We know that SU is offering kind of a pre-registration through the Shine Center. I saw a form on its website.
Yeah.
They may or may not get the state supply that they've asked for.
Well, they didn't get it this week, so we're giving them vaccine. So
then
yeah.
Then update us. So will the county
1,500 doses.
is sending SU to campus some vaccine?
Correct. Yeah, I think it's Wednesday. Is it Wednesday? Yeah, Wednesday, 1,500. We'll look to do something bigger this week as well. But yeah, so I think they've already registered 1,500.
And that's just the supply is Onondaga County's role. Their infrastructure can do the rest.
We believe so with that. We'll probably participate in a larger clinic with them. But again, working through schedules and space, right? You need to do a larger clinic. You need one of their larger facilities.
And how far along are conversations with high schools to begin vaccinations directly in partnership with the districts?
Yeah, so I think we believe really that we're gonna have more supply than demand. If we don't now, technically we will very soon. So we want to start those conversations now, so that we can start either working those remember vaccine week's Wednesday to Wednesday. Work some of that into the end of our upcoming vaccination week or the following week, in whether that's us getting consent from parents and then bringing kids down here, or us going to some of the larger schools. We'll get it done. The juniors and seniors in high school, there's COVID there, so that's something that we want to get those kids vaccinated, and that will be a good test run for the 12 to 15-year-olds. That will certainly, the data coming out of the Pfizer vaccine, 100% effective for that age demographic. So at some point in 2021, that demographic will be eligible for this vaccine. So we want to, obviously get a system that works well for the high schoolers that then can be offered for essentially your middle schoolers.
I hate to call it a field trip, but do you foresee school districts sending bus loads of kids during the school day to the on-center?
I think certainly you could see that, yeah. It would be the field trip to the on-center. They used to do that when they're little. Now they can do that when they're in high school. But that we may be in some of the larger high schools too. We may be setting up clinics.
If the county does see a rise in COVID cases, would that impact schools reopening at all, or are those kind of like open for good?
Yeah. If you look at it where you are, it's if the positivity rate in the community changed drastically, that anything's on the table, right? But where you are now isn't a surprise. Again, we could do some research to see where our positive rate is to any county in the country, our size, but I bet you it ranks right up there. So these are numbers that are a little bit higher than where we were 2 weeks ago. The contact tracing shows the narrative. We're now going to be vaccinating these same groups that we couldn't vaccinate before. So we think 4 weeks from now that we'll be in a really good place.
You mentioned there's a pop-up this week at the Hamilton
Yep.
Street Boys and Girls. What other areas are you looking at to do pop-ups in? Is it mostly urban neighborhoods?
Yeah, so early zip code data shows we still got work to do in the city. zip codes. So obviously 13210 is one of those. So that will get a lot of attention. But I believe we have at least one, if not two, other pop-ups within the next 10 days with different churches as well. And then I think we got to focus in on getting through these micro-targeted cases, colleges, high schools. There's enough vaccine infrastructure out there for others in these demographics to go to the drugstore, to go to the fair, go to our appointments here as well. But once we get through this push, because we know who those kids are, we know where the students are, and we know easily if they've gotten it or not, if we're hitting our numbers there, then we need to completely change strategy to go into these zip codes where we have room to gain, real room, right? So a lot of it will be micro-targeting, I think, in 2 or 3 weeks from now.
Do you know how SU picked the 1,500 students for a clinic this week?
I think it was based probably on our conversations, what we thought supply we could give them is probably how they. Do I know who or how?
Yeah,
I
who? What
don't.
categories did they
My
go
guess
under?
is they're congregate settings. My guess would be that they're congregate settings, so they're the dorms, and people just registered out of those dorms. Yeah.
And
I
that-
don't know what ones or anything like that.
And that 1,500 just comes out of your weekly supply.
Yeah.
And nothing yet. Obviously, that's a small number, but anything yet for the other schools in the county from you?
Well, we're talking to all of them. Some of their kids have already been coming down here or are already registered. So ESF had 1,300 students.
And I think that's an important point.
Yeah.
That just because the campus doesn't have them, that doesn't stop anybody from making
Right.
an appointment here.
Yeah, and I know some of them are already qualified for different reasons and have already been here. So certainly we're going to work with making sure the Lemoyne population, ESF population, SU, and OCC we're talking to as well. Other questions? No? Okay. Thanks, everybody.